Sorry guys, after all that water I've been drinking for the digestive system and the endocrine system, I just really had to do the act of micturition, which is voiding my bladder, urination, all those different words. Hey, we're talking about the urinary system today. So the urinary system is one of the reasons why it's important to stay hydrated, because what the urinary system does is constantly filter your blood and pull out wastes. If it pulls out more wastes than water you have in your system, the water is going to go with the waste and you're going to be very dehydrated, and dehydration is a concern. You don't want to be dehydrated. Conversely, you can have too much water. It can kill you. You can overdose on water. Your body typically stops you from doing that. It'll make you vomit or force you to urinate against your will, because the body doesn't want to die. But there have been instances where people have died from ingesting too much water. You're going to learn about that in the six weeks. So the urinary system. Ooh, ah. Here we go. Possibly buttons work and things happen. The urinary system. Oh my God, what is going on? Thank you. Anatomy and physiology, pathology, diagnosis and treatment, as always and forever, amen. Combining forms, albumin, which is actually the literal word is albumin. Sorry, the glare on the glasses is annoying. So albumin is a waste product. It's a protein in the blood that the kidneys filter out. Bacteria, because the fact that the urinary system is exposed to the outside, because the urethra flushes urine out of your body, bacteria can travel up the urethra, into the urinary bladder, up the ureters, into the kidneys. So you can have infections in any one of those 4 locations, or if it's very severe, in multiple of those locations at once. A calcule or calculi is a stone, as is a lith. Lith means stone as well. We talked about stones in the digestive system with the gallbladder. The gallbladder can make stones out of all those bile salts. Unfortunately, the kidney is also highly susceptible to making kidney stones. And you can even have bladder stones in your urinary bladder as well. They're not pleasant from all accounts. I have not had them. My husband has multiple times. And I thought he was dying the very first time they happened. We were in the hospital. He was in extreme pain. It was very weird. Not weird, it wasn't right. And then what I've heard from females who have had kidney stones, passing a kidney stone is worse than having a baby. Nephro means kidney. Like cardio means heart and gastro means stomach, nephro is one of those words you have to know. Along with hepato meaning liver, osteo meaning bone, the major words. Hylo is part of the renal pelvis, and we'll talk about what that means. Rene also means kidney. Renal system is also another word for the urinary system. And nephro. Nephro is the one you need to know more. Does that make sense? Know them both. Trigon is for the trigone region of the urinary bladder, and I'll show you that in the PowerPoint. Uro means urine or the urinary tract. And vesico means urinary bladder. We have seen most, if not all, we have seen all of these prefixes before. And a and an, dia, dis, hyper, and enter. You should know these by now. We have seen gram and lysis before. I think we've even seen, besides urea, all of these. Gram is recording, or is a record of a recording or an image, like an X-ray image is a gram. No, it's not, it's called an X-ray, but technically it's a gram. Lysis, breakdown, separation, loosening. Pexy, surgical fixation. Poetin is a substance that forms. We have seen poetin before, if you don't remember, in the cardiovascular system. Stitial means pertaining to a standing or sitting, I think they missed the word sitting position. And urea is condition of urine or urination itself. What are the following word part meanings? Maybe you have read your chapter like you have already been supposed to. That's why it's listed before you look at these lectures. Maybe you haven't. I don't have a fancy way for you to remember azote. It means nitrogen. It just does. You just have to accept that. Kali also is calyx, and that is a word that we use when referring to part of the kidney. Oligo is scanty. Scanty means little. So little is oligo, but the technical term is scanty. Ureter is ureter. So the whole entire word is there, and then the combining vowel. The ureter is what leads from the kidneys to the urinary bladder. So it's how urine that is formed in the kidneys gets to your bladder. Dia means complete or through. We know that by now. Seal means hernia or swelling. Iasis is abnormal condition, and trypsy, which is a fun word, is crushing. And so all those stones that can be created, the kidney stones, the gallstones, the bladder stones, we actually have a couple of ways to treat those, and one of them is by crushing the stones with sound waves. We'll get to that. Functions of the urinary system. Filtration. It filters your blood. Okay, the liver is also filtering your blood, but it has a different purpose. The kidneys are filtering your blood, and that's how we actually remove the waste from the body. So as we remove the waste from the body, we have to store it until it's able to be secreted, and that's what we do in the urinary bladder. Along with the adrenal glands that we learned about in the endocrine system on top of the kidneys themselves have some hormone production. And then, of course, in removing wastes and excess water, we are maintaining homeostasis. The kidneys lie in the retroperitoneal cavity. So what that means is everything in front of this has been removed. We have the large intestine, the small intestine, the stomach's up here, the liver's here, the pancreas, the spleen. It's all been removed, as has the peritoneum. And the peritoneum is the sac that holds all those organs in place. So the kidneys are retroperitoneal. They are behind the peritoneum. And they are kind of attached by ligaments to our back muscles and are not protected by a membranous sac. So we've cut all those organs out of the way so that you can see the two bean-shaped kidneys here. Along with that, you have your adrenal glands on top of the kidneys, and you can see how the veins and arteries go into and out of, because veins come out of and arteries go into the kidneys here. Then, kind of hard to spot, but still noticeable, are the ureters that are coming out of each kidney. Okay, so these thin, skinny cords, these are the ureters, and they are going to the urinary bladder. No, that's the uterus. Where's the bladder? Oh, down here. So it's behind the abdominal wall. So you can kind of see it's shaped there. The urinary bladder is made of transitional epithelium, which is a beautiful thing because that means it can expand to hold waste. So if you remember from the integumentary system, no, I don't know if you would remember because I don't think we covered it, but what you will learn almost immediately in Dr. Bradley's class next year is all the different types of cells we have in our body. And one of them is transitional epithelium, and the bladder is really the only place we see this, but they start out square shaped. I don't know how to make a square like that. And then as the bladder fills up, they flatten out. So they stretch. And when the bladder is empty, they go back to square shape. I don't know if you can see the square in my fingers. And then when they fill up again, they stretch and flatten out. They're transitional. They change shape. That allows you to hold urine for a certain amount of time. Eventually, you almost have no choice but to pee. When you were toddlers running around in diapers, you did not have control of your urinary sphincters or your anal sphincters, which is why you were wearing diapers. And it's something we learned 3 or 4, depending on when you were potty trained, was how to control those sphincters. So Each set, actually the urinary system and the defecation system has two sphincters. There's an internal one you don't control at all. And then there's the external one that allows you to say, yes, I am sitting on a toilet. It is time to release the urine, or men standing next to a toilet, whatever. And that's the one you control. But if your urinary bladder gets too full, it'll override you and you will pee your pants because the body needs to get rid of the wastes. So keep that in mind. The urethra, this is a female, and in the urethra of the female is about 1.5 inches long, and it expels at the top part of our external anatomy. This is a good time to mention females have 3 openings in their external anatomy. We have the urethra, we have the vagina, and we have the anus, okay? Men have 2. They have the urethra and the anus. And for men, the urethra is both where urine comes out of and where ejaculate comes out of. So it's both a reproductive organ and a urinary system organ. But females, we have 3 separate. Our vagina is for reproduction. Our urethra is for the urinary system. So they're separated, not like men. So if we were to cut into a kidney, slice it in half, there you go. This is what you would see. The renal cortex is the outside. We talked about cortex versus medulla in the endocrine system. The outside is full of billions of what we call nephrons, and the nephron is the filtrating subunit of the kidney. So the nephron is responsible for filtration, reabsorption, and secretion, and we'll talk about each 3 of those in a minute. The renal medulla are these pyramid-shaped, well, pyramid is a loose term. These are these kind of triagonal pyramid-shaped things. And this is where blood flow, the capillaries are being broken down into the smallest part so they can go to the nephron. And the renal pelvis is where the ureter leaves from, carrying waste products, so carrying urine, and where the arteries and the veins go into and out of. So this is the renal pelvis here. Inside a nephron, there's many, many terms that you're going to have to eventually know by the time you graduate high school. One of those terms is a Bowman's capsule. Now what a Bowman's capsule is just like a ball of capillaries around a glomerulus. So here's the word glomerulus, okay? The glomerulus is the filtrating substance of the nephron. And so each nephron can have many Bowman's capsules and many glomeruli. And so what happens, I'm gonna say what happens, and then we're gonna watch a short video that also says what happens. The capillaries branch down into their smallest part, right? And they're closely associated to the glomerular capsule. And so number 1 is filtration. Remember, filtration, reabsorption, secretion. Filtration. And so at this stage, nearly everything leaves the capillary and goes into the glomerular capsule. We're talking the water, the salts, the minerals, the vitamins, the sugar, the urea, any waste products, any drug products you have in your system. Like I say drugs, I mean Tylenol or Advil. When you say drugs, you might mean something different, but still drug products. It all leaves the capillary during the filtration. Not all, but most of it leaves the capillary during the filtration step. And it's in what we call the renal tubule. It goes to the renal tubule. Now, as the capillary travels along the renal tubule, much of that stuff comes back to the bloodstream. Most of the water, most of the minerals, some of the sugar, some of the salt, some of the vitamins, all come back to the bloodstream. It's like, whoa, we overdid it, guys. We need that stuff back. That's kind of important for us. That's reabsorption. Further down, then the blood system's like, hey, you forgot to pick some stuff up. Here's some things that actually are waste. And this is urea, which is a waste product of the liver from breaking down proteins. And it's also what gives your urine a foul smell if you're very dehydrated. And drugs and other components. And so that's, you filtrate everything, you get rid of everything, you pull back what you need, and get rid of things that you still need to get rid of. So that's what 1, 2, and 3 are. Now, having said that, we're actually going to watch a video that basically says the same thing, but it's okay because you need to learn. Everything out of the way. Thank you.
The three-step process of urine formation, filtration, reabsorption, and secretion occurs in the nephron, which consists of a renal corpuscle and a renal tubule. Filtration takes place in the corpuscle. Water and solutes move from the glomerular capillaries into the glomerular capsule. The fluid is now called glomerular filtrate. During this process, the fluid passes through a filtration membrane that prevents blood cells and proteins from entering the filtrate. During reabsorption, filtrate moves from the glomerular capsule into the renal tubule. As it flows here, water, ions, glucose, and other substances move back into the capillaries. At the same time as reabsorption is taking place, wastes and some ions, drugs, and toxins are actively secreted from the capillaries back into the renal tubule.
And there you go. That is the function of the kidneys. Filtration, reabsorption, secretion. When everything is done being filtrated, then you have collectively what we call urine. The bloodstream goes along its happy way and goes back and does all the cardiovascular system again. But whatever filtrate is left in the renal tubule is now urine. See? Urine. Right there it is. And contains excreted substances. So that urine then travels down to the ureters. You have no control over this. It's through peristalsis. Remember, peristalsis is the wave-like contractions that the esophagus and most of the digestive system goes through. Same thing happens with the ureters, and it collects in the urinary bladder. So here's the 2 ureters coming down, and here's the urinary bladder. I told you about that trigone words, Trigone. It's this triangle shape right here is known as the trigone of the bladder. It is important. It's, I believe, where the 2 ureters come in and where the urethra goes out. Oh yes, ureteral orifices and then urethra. And then the urethra itself. So I told you in females, the urethra is about 1.5 inches long, and males, the urethra is about 8 inches long. This is only due to the anatomy of males versus females, but it does typically help males also not get as many urinary tract infections because that is a much longer urethra that bacteria have to travel up through versus the female urethra. And that is then how we release. Remember, the female urethra is for urine only. We also have the vagina that does all the reproductive stuff. I know that you're like, why do you keep saying that? Because a lot of people don't know that. So I'm making sure that you know that. Hello. What is the medical term for the basic structural and functional unit of the kidney? We find them in the renal cortex. It's where the Bowman's capsule and the glomerulus is. Starts with an N. And it's called a nephron. Oh, what is the function of the renal calyces? Collect urine and direct it to the urinary bladder. So I did not mention that. Let's go back to here. Here is your renal calyx in the renal pelvis. And here it's branching up into calyces. And so all the calyces drain into the one ureter. There we go. Now y'all know. And knowing is half the battle. Oh, okay, we're going to go straight into signs and symptoms. I plan on doing this all in one lesson. Anuria, anuria is the absence of urine. Glycosuria is glucose in the urine. That's a bad thing. That is typically a sign of diabetes. That means that either you have too much sugar in the bloodstream, and so even though your body is filtering it, you just have that much sugar in the bloodstream, or your body is, no, that's just what it means, I'm sorry. How did we test for diabetes back in the day before we had actual tests? Physicians would taste urine. Now, that's fine. The urine is, I mean, it's not fine. You're probably like, ew, gross, you're tasting somebody else's urine. Yeah, well, they didn't have anything else they could do. And if they tasted sweet urine, it means you were a diabetic. Great, you have a diagnosis, but there was nothing they could do about it. So it was basically a death sentence, unfortunately. So that is sugar in the urine, glycosuria. Urinary incontinence is the inability to hold your urine in your urinary bladder. Sometimes the urethral sphincters get damaged. Common in pregnancy, they're not damaged, but they are being put under a lot of pressure, and after giving birth as well. But also they can actually be damaged, and your body no longer has the ability to hold urine. So every time you cough or sneeze or laugh or do something, you pee a little, or a lot. Also, it's just a symptom of aging as well. So, yay. Urinary retention is the opposite. You are unable to empty your bladder fully. Now, if you are completely unable to empty your bladder, you're going to potentially die. Potentially. I mean, we can get to a hospital and stick a needle in there and draw out the fluids. And here is a catheter in the urinary bladder to get fluids out. But your bladder can only hold so much, and then it will rupture, and that can kill you. Urinary retention is more seen in males due to their enlarged prostate, which is very common in men. It's a very common disorder, is an enlarged prostate. And if you have no idea what I'm talking about, an enlarged prostate. So here is the bladder, here is the penis, but here is something that's called a prostate gland. Females, we don't have an equivalent. We have nothing that is the equivalent to a prostate. We have almost an equivalent to nearly every piece of male anatomy except for the prostate. And as men age, what typically occurs is the prostate gets inflamed. And so it squeezes the urethra right here, and urine has a hard time being removed from the bladder. Okay, so here's some signs and symptoms. You have dysuria. We know that urea is pertaining to urination, and at this point in time, you very much should know that dys means difficult, painful, or bad. So painful, difficult urination. And then oligo, remember oligo means little, but that's not the word that you're supposed to use. You're supposed to use a word that starts with S. And then urea, we're talking about urination. It's scanty urination. So when only a very small amount of urine is produced, like when you would have urinary retention. Cystitis is inflammation of the urinary bladder, probably caused by bacteria. Glomerulonephritis is inflammation of the glomeruli in the kidneys. I don't know what causes that. And interstitial cystitis is, I looked it up, I read it, pertaining to between standing, nope, I'm not gonna remember. There's so many things to remember for each chapter. Interstitial nephritis. Oh goodness, where is it? Chronic inflammation of the bladder wall is what that stands for. So chronic inflammation of the bladder wall, not caused by bacteria, something that's going to keep happening to you over time. And that's unfortunate. Large screen, please. Phenylketonuria is something that you were tested for within the first week of being born. Actually, it's one of 20, I want to say 5, I want to say 6, 20 some odd genetic disorders that you are tested for. And what happens is they prick the heel of the baby. I know this is a hand, but pretend it's a foot. And they prick the heel of the baby and they put droplets of blood on a card. And that card is shipped off to the Department of State Health. And it's run through something called a mass spectrometer. Multiple different mass spectrometers because you're testing for many different things. And one of the things is phenylketonuria. So that is a genetic condition. Phenylalanine is the amino acid that you are not being able to, you cannot process phenylalanine when you have phenylketonuria. So what happens is the phenylalanine builds up and builds up in the bloodstream. And when that happens, it can cause organ damage and brain damage. And so some of the common symptoms of phenylketonuria is intellectual disability and developmental delays because of this damage. Thankfully, it's very easy to treat and very easy to catch, which is why we do these heel stick panels on newborns, so that we can catch disorders like that, because there's a lot of disorders like that, before they harm the baby. Polycystic kidney disease is cysts forming on your kidneys. So your kidneys malform and are not as effective at producing the hormones and creating the waste. A urinary tract infection is a bacterial infection typically introduced through the urethra that can, like I said, it's in your urethra, it can be in your bladder, it can go up the ureters and be in your kidneys. Kidneys infections are severe. They are always treated as a severe thing, because if your kidneys are too inflamed, they're not creating waste, they're not doing their job, and it can very much kill you. And they're easily treated with antibiotics. Define these diseases or conditions. Nephro, what does that word mean? It's one of the words you must know before you can graduate. And I hope you're all screaming at me, kidney. And then lith means stone, and abnormal condition. So this is the condition of kidney stones. And then pyelonephritis. Now remember, pyle means that renal, no, is that what that means? Pyelonal means, yes, the renal pelvis, nephro is kidney, and then itis. So inflammation of the renal pelvis of the kidney. Remember, the renal pelvis is where the arteries and veins are entering and exiting, and the ureter is exiting with the urine. Diagnostic tests and procedures. There's many diagnostic tests and procedures for everything. Obviously, we only go through just a few brief ones each time. Biopsy, and then there's multiple different types of biopsy. So excisional biopsy is when you remove the entire lesion or the entire tumor. You take it out, X is out. We are excising this whole thing. And then it's going to the lab to be looked at. An incisional biopsy is where you cut off a piece of the lesion or the tumor, but you don't remove it completely. Maybe because if you tried to remove it completely, it would be devastating to the human body. Maybe because you don't think it actually needs to be removed and you're pretty sure it's benign. There's plenty of reasons. Maybe you're just checking out what it is. Hey, what are we looking at? I don't know what to do with this. So you just take off a piece of that, and then that goes to the lab, but the problem area stays with the patient until you have further results. And then a needle biopsy is taking a hollow needle and punching into whatever you need to biopsy. And so the cells are in the tube of the needle there, and then you send that to the lab. What we're viewing in the picture is a cystoscopy. Scopy is to view, and cystoscopy, sorry, cyto means cell, cysto means bladder. And this is a very thin, flexible rod that goes up the urethra, males and females, into the bladder. Now, there's many different reasons this might need to be happening. You could have bladder stones, or you can have bladder polyps, which are excess tissue that's being formed that can turn cancers. You can have bladder tumors. You can have lots of things. And so through this thin, flexible tube, you can send a camera in, you can send other manipulative, like tiny little scissors that'll help you cut off the polyps or the tumors or whatever. I don't know, it's kind of a cool little feature thing. This x-ray, the KUB x-ray, the kidneys, ureters, and bladders, exactly what it sounds like. You're x-raying the kidneys, the ureters, and the bladder. So you will have to ingest a substance, or they will inject it in an IV, and it'll highlight the kidneys, the ureters, and the bladder, and you'll get an x-ray for that. Sonography is what we're looking at in this picture. Typically, the common thing you see this for is, baby photos, but it's using sound waves to record an image. In this case, we are looking at a kidney, and they are showing a kidney stone right there in that white dot. And then a renal angiogram, let's break it down. Renal means pertaining to the kidney. Angio is blood vessels, and gram is an image. So an image of the blood vessels of the kidney. Then we can get into dialysis. Sometimes the kidneys stop working. You're in kidney failure. And I say sometimes, but it's actually very common in America for lots of different reasons. Congestive heart failure, diabetes, just general not taking care of yourself in the long term can lead to kidney failure. When that happens, people have to go through dialysis because the kidneys are not filtering the blood. So toxins are building up in the blood. And guess what? If toxins build up in the blood, you're gonna die. So 2 or 3 times a week, people have to go to a clinic and have dialysis done. There's a couple of different types of dialysis. The hemodialysis is probably the most common, and that's what we're seeing here in the picture. Heme referring to blood, dia complete or through, and then lysis is, in this case, removing. So what's happening in hemodialysis, a machine receives the waste-filled blood, so this little squiggly line here, your dialyzer is your machine, receives waste-filled blood, filters it for the human being that's suffering from kidney damage, and then sends the clean blood with dialysate back into the human body. So you don't actually lose your blood in this process, but it is being cleansed. In peritoneal dialysis, I told you that in the abdomen, everything is held in place by the peritoneum. So in this one, a catheter is inserted into the peritoneum. And that dialysate, this word right here, this dialysate, is actually pumped into the peritoneal cavity. And so it's going to be like a little too watery, and it's going to draw wastes into it, because something we haven't talked about is that in the human body, everything is on a diffusion gradient and goes from high to low concentration. So all the wastes are going to go to where they aren't, and this dialysate in the peritoneal cavity, because that's the low concentration, and then we remove the fluid with all the wastes by a catheter. And then lithotripsy, I told you tripsy means crushing at the beginning, and litho means stone. So this is crushing a stone. We use sound waves to do lithotripsies, or shock waves, sound waves. So a procedure in which high energy shock waves are used to break up stones in the kidney and the bladder or the ureter into smaller pieces so they can pass through the body. Lithotomy, otomy is incision, lith is stone. This is when you are having to cut into the kidney or the bladder or the ureter to get that stone out. And depending on what makes the stone, there's lots of different crystals that can form in your body: calcium, nitrogen, potassium. Pick an ion, you can make a crystal out of it. They're either really sharp and spiky, like this one, or they're really bumpy and kind of small, like this one. They have different sizes, different shapes, and they're doing different damage to you. If they get too big and you can't crush them with the shock waves, then you have to go in and physically remove them through a lithotomy. A nephrectomy is the removal of a kidney. You can live without one kidney. And, you know, people donate kidneys to other people who have no kidneys that are working. And that's fine. And you can live without one, but you can't live without both. And then renal angioplasty is, of course, the surgical fixation of the blood vessels of the kidney. Okay, define each structural procedure. We've already done this, but lithotripsy is crushing stones in the kidney or ureter or bladder stones. And nephrectomy, ectomy is removal of, it's like the first word you learn, and neph is kidney, so surgical removal of the kidney. We have our common abbreviations, CAT or CT. CT doesn't have the axial word in it, but CAT is computerized axial tomography, or CT is just computerized tomography. It's actually referring to the same procedure These are the machines that can move all around the body and take like 3D images of what they're trying to look at. Cysto in giant letters is cystoscopy or cystoscopic examination. We saw that thin flexible tube go up the urethra into the bladder. IC is interstitial cystitis. Remember, that's the chronic inflammation of the bladder tissue. pH is the pH scale that you learn about in chemistry. So, and you'll learn about it again. Well, many of you might be in chemistry now, I guess, but if you're not, you're in biology, and then you'll learn about it again in chemistry next year. Specific gravity has to deal with how, when you give a urine sample, when you pee in a cup for a doctor, the specific gravity is one of the things they're checking for. It's basically how dense your urine is. Are you hydrated enough or not? And VCUG is voiding cystourethrogram. So this is a measurement of how much you are able to urinate out your body. And if you didn't catch it at the very beginning, the medical term for urination is urination, but also micturition. So that's just so that you know that. Identify the meanings of the following common medical abbreviations: KUB, kidneys, ureter, bladder, ureters, there's 2 of them. 2 kidneys, 2 ureters, 1 bladder. PKD is polycystic kidney disease. And UA is a urinalysis. So when you pee in a cup, what you're actually doing is giving a sample for urinalysis. And they check for specific gravity. They denote the color and the amount. They check for bacteria, white blood cells, red blood cells, sugar. I used to do urinalysis. You think I'd remember more. And they can do it 1 of 2 ways. Well, really, they can read it 1 of 2 ways. It's a dipstick that you just dip in, and there's little boxes that change multiple colors. And you can either just read it by eyesight after a certain time frame, or there's a little machine that you stick it in and the machine reads it for you. The machine is much more efficient. All right, that is the urinary system. Thank you for hanging out with me this whole entire time. I bet you all need to go urinate now. You should probably do that. It's not good to hold your urine in. It's actually very bad for you. Don't do that.